11 years ago, there was no or very little patient-oriented human genetics and genomics research. Wonderful basic science research, wonderful basic genetics research, but none of the patient-oriented research. And essentially, there was no or a part FTE genetics professional trying to practice all of genetics. So when Dr. Cosgrove, the CEO of the Cleveland Clinic, recruited me, I proposed to have a single platform of patient-oriented human genetics and genomics research translated into clinical care, the Center for Personalized Genetic Healthcare. And 11 years later, we do practice the comprehensiveness of all of medical genetics, from prenatal to Alzheimer's and cancer especially. And we just started our first outpatient pharmacogenomics clinic on July 1st. I'm very proud of that.
Cleveland Clinic has an outpatient pharmacogenomics clinic that physicians can refer their patients to. These are patients that are usually not responding to the drug therapy as what the physician would expect them to respond, and they can refer them to us to get genotyping, and we can look at the genotype results and see if genetics is an explanation for why the patient may not be responding to the drug therapy as well as what would be expected.
When I walked in, there wasn't any patient-oriented genetics or genomics research. So I looked around the Cleveland Clinic and say, we need to build on the strengths of the clinic, and that is cancer from the Charis Cancer Institute, cardiovascular, pulmonary, and possibly neurological. And then I said, if we just put one or two key genetics professionals in there, or researchers, would we lift it up? And that's how we have recruited. For example, Dr. Ting was recruited from Johns Hopkins, and she works on colon and prostate cancer and in the field of epigenomics.
I work on DNA methylation, which is a form of epigenetic modification. It refers to non-sequence altering modifications on top of the DNA, and has the capability of modifying the expression of the genome and thus altering phenotype of the cell and the organism.
So the Center for Autism is a full-service clinical center, and we've been able to take our research program, which is built on top of the clinical center, and really expand it by collaborating with GMI and Genomic Medicine, particularly with Dr. Eng. And it's really a natural collaboration because Dr. Eng is the first person to discover that P10 was a predisposition gene for autism spectrum disorder. And so once we sort of came together on that idea, we decided, oh, this is a natural collaboration. Let's study individuals with P10 mutations who have autism.
The standard model, traditional model of practice, which is still common in many places, is to associate a medical geneticist with a genetic counselor. Because there's so few geneticists, that also prevented access to patients. We were the ones we were the bottleneck. So I uncoupled geneticists and counselors so that the genetic counselors are in fact empowered to practice to their skills and expertise. By doing so, we are able to in fact embed or integrate many of the genetic counselors in many subspecialty clinics. For example, the cardiomyopathy clinic, or the breast cancer clinic, the ovarian cancer clinic. The colorectal cancer clinic with Brandie Leach is very popular and very busy.
So when a patient comes in for a genetic counseling session, there are a few things that pretty routinely happen. First, we're going to collect some information about your personal history and your family history, and then based on the patterns that we see in those histories, we can identify a or maybe several genetic conditions that we may be suspicious of. We educate the patient about what those conditions may be, what identifying that condition would mean, and what risks to other family members may be. And then if there's genetic testing that's appropriate, we would coordinate doing that genetic testing for the patient at that time.
It was actually on the day of my breast cancer diagnosis in 2012. I was diagnosed as stage 0 by Dr. Deborah Pratt at Cleveland Clinic, and she advised me to seek genetic counseling. So I was seen immediately due to my breast cancer diagnosis, and my genetic counselor, Brandie Leach, she conducted a comprehensive analysis of my family history and suggested I go for a blood test to test for BRCA2. She actually saved my life because she also informed me of the other cancers I was at high risk for, which was ovarian, and that is a 50% chance of being BRCA2 to inherit that cancer.
The Genomic Medicine Institute is wonderful. It's a resource that few cancer centers have. So we collaborate from a research perspective. The clinical genetic screening infrastructure is housed within her institute, and that's become very intimately connected with the Taza Cancer Institute and will continue to be so for the indefinite future.
We strive to be the experts in the principles and practice of modern genomic medicine, and that encompasses education as well, because without education we can do all the research in the world, we can try to see patients, but that's not very responsible to society at large.
We feel that it's our duty to provide education and outreach to different areas within the community and within the healthcare profession. Within the healthcare profession, the genetics understanding is somewhat low, so we feel our job is to provide grand rounds, genetic symposiums annually to give them updates on what's available, how it affects their current clinical practice, and how it helps their families.
We like to think outside the box, and the Cleveland Clinic's environment challenges us to do that and almost imbues us with not being afraid to try new things.